Okay, Ramon, can you tell me what the paper is called and what the sort of broad themes? What did you look at?
So this paper is called Preventing the Next Pandemic, Lessons from East Asia. And our idea was to understand countries that have done quite well in dealing with this pandemic, how they have achieved these good results. And what we decided to focus on is institutional capacity. The reason being that there are some other explanations out there. Some people talk about culture, for example. We think that these explanations cannot be replicated in other parts of the world, but building institutional capacity is possible to replicate this in Western Europe, in the US, in different parts of the world as well. So there are lessons that we can gain from this experience.
Okay, good stuff. And what were the broad findings? What were the results, as it were?
So I think we have three main findings. The first finding, which applies to the current situation, is that these countries learned from previous pandemics, let's say, for example, SARS or MERS, and they started to build their capacity and to prepare for the next pandemic. Now, as we are suffering from this pandemic in Western Europe, for example, we should start preparing for the next pandemic right now, and then we'll be ready to tackle, even if it's a second wave of the coronavirus in a few months' time. The second lesson that we learned from this conducting this research is that once lessons have been learned, they cannot be forgotten. And this is something that happened, for example, in places such as the US. It learned from the Ebola pandemic during the Obama administration, but this lesson was lost during the Trump administration because of partisanship. So what we saw in East Asia is that there are countries that put partisanship aside, and they decided to have institutions, specialized institutions led by experts, to, once the lessons have been learned, to keep them until the next pandemic. And when we saw the current coronavirus pandemic kicking in earlier this year, starting from January, in the case of countries such as China, Hong Kong, or South Korea, for example, what we saw is that these institutions were able to start to implement the lessons that had been learned. Now, the third key finding is that when it comes to institutional capacity building, there are three broad areas in which we can actually learn lessons. First of all, how to develop a legal infrastructure in case of emergencies. A pandemic obviously is an emergency situation that gives the government special powers over a short period of time, so while the pandemic is in place, to take decisions more quickly. The second one is that the healthcare and public health system have to be ready and have to be able to operate without obstruction from politics. So what we see here is that these countries, both the healthcare system and the public health system, they have been operating throughout this period of time because they had been prepared. They had PPE equipment, for example. Test kits were developed very quickly. So this allowed them to deal with the pandemic in a very efficient way without their healthcare systems being overwhelmed. And the third point or lesson that we learned is the use of technology. So there's a lot of talk right now in the UK and other European countries about contact tracing. This will involve technology, for example, the use of mobile phones to track people. There is obviously a debate between privacy and the safety of the population. But what we see is that technology can be deployed in different ways to support the healthcare system throughout the pandemic.
Okay, and what's the view in Asia of how they have performed themselves in terms of managing the pandemic, the first wave and the potential second wave?
It is interesting because if you look at countries such as South Korea, Taiwan, China, surveys that have been conducted, independent surveys that have been conducted, people in these countries felt they have dealt well with the pandemic. Obviously, this wasn't the case in January, February, when the epicenter was in the region, but as of mid-May, we see how there's a sort of pride in how they have dealt with the pandemic. In other countries, there has been a little bit more criticism. This is the case, for example, of Japan, Hong Kong to an extent, but it's also true that if you look at clinicians, for example, if you look at academics in the region working on pandemics, the general consensus is that they have dealt with it, right? They have done well with it. And the reason being that the healthcare system has not been overwhelmed. Second reason that if you look at the excess rate, but also death rate per capita from the coronavirus, it has been quite low. And the third reason being that now obviously they're looking at other parts of the world and they realize how well prepared we were to deal with the pandemic.
Okay, and looking to the future and the next potential pandemic, what are a couple of key points that Western European nations can learn from what's happening in East Asia?
I think the two most important points is number one, we need to start preparing for the next pandemic right now. We cannot wait 1, 2, 3 years time when we won't be paying attention to these type of issues. We have to start learning right now. Once the first wave of the pandemic has gone from Europe, there are very few infections. We should be looking into it. And we should be looking at learning lessons, not only the government itself, but as I mentioned before, we should have experts involved, institutions involved, that in the future, when there is a change in government, in 1, 5, 10 years time, depending on the country, these lessons can be implemented. And I think that the second lesson, number two, is that regardless of the debates we may have about the use of technology, procurement for healthcare professionals, as I mentioned before, for example, PPE, masks for the general population, it does pay to implement these decisions and to implement what East Asian countries have been doing according to our own values, according to the decisions that we might take as a society. So if we think that some tracing apps, for example, are too inclusive, that is fine, but some sort of tracing should be taking place. If we think, as was the case in some Western European countries, that hoarding masks might not be useful because they might never be used, well, that is fine, but that's a decision that needs to be made needs to be made in an informed way, and we should have at least a critical amount of masks, PPE kits, for example, for healthcare professionals in place, because as we have seen, when it comes to try to procure this during the pandemic, is simply not going to work.
Okay. And in the paper, you touch on the sort of cooperation and coordination across East Asia, and that being an element of their success, learning from each other. Do you think that's possible for Western Europe, and that's the road they should be going down, closer coordination?
I think it is possible to coordinate, to learn from each other. What we have seen in East Asia is that the agencies that are involved in dealing with pandemics, they talk to each other, they have visits to each other countries, they are in regular contact. Throughout the pandemic, there has been a learning process, what has worked in other countries that might work in our country. In my view, this would be a non-brainer in Europe, because obviously our people-to-people links, tourism, business, are strong. As strong, is not stronger than they are in East Asia. So any pandemic affecting one European country is very likely to affect other European countries relatively quickly, even before we notice that we have a pandemic.